Hi, I'm Dr. Mike Atkinson, and I'm here today with King, one of our black rhinos. We have recently been working with a challenging medical case with Layla, one of our other black rhinos, and wanted to take the opportunity today to share a little bit with you about that case. A few months ago, our veterinary and animal care staff began noticing that Layla was having some difficulty breathing. Our staff did a complete examination at that time and started Layla on some treatments for what we presumed was a simple sinus infection. However, Layla failed to improve quickly with that treatment, and our staff began to be concerned that we were dealing with a more serious problem. Considering our options at this point, we decided to move forward with what we call a sinusotomy surgery, which is basically an approach to the sinuses from the outside. And in order to do this, we brought in some colleagues from North Carolina State University College of Veterinary Medicine, Drs. Blixlager and Gerard, who are both veterinary surgeons that have a significant amount of experience working with rhinoceroses. Most of that experience has been gained from working with rhinos that were the victims of poaching in Africa, where the horns had been removed by poachers, leaving a large open wound on the top of their head that extended down into the sinus cavities. Working to help these rhinos in the wild has provided them with a wealth of information on the anatomy and the normal sinus structures within rhinos that we were able to utilize for planning this surgery with Layla. In January, the team from North Carolina State University, along with a veterinary surgeon, Dr. Chris Downs from the Chicagoland area, and our team of veterinarians from Brookfield Zoo, undertook a surgery on Layla in order to access the deep parts of her sinuses and her nasal passageways to try and address this infection and get Layla breathing more comfortably. That surgery was very successful, and Layla did fantastic following the surgery. However, we were not able to be completely certain that we had gotten the deep parts of the infection and felt that a more advanced imaging was going to be needed. With any sort of rhino, their skull is extremely thick, and our typical imaging options such as x-rays just don't have the ability to penetrate through that skull to provide us with the type of diagnostic images that we need to really assess the sinuses. Knowing this, we started looking at our other options using computed tomography or a CT scan of her head. We are very fortunate here at Brookfield Zoo to have our own CT scanner in our animal hospital, but at 2,300 pounds, moving Layla into our hospital and being able to get her into our scanner was just not something that was going to be possible. We were very fortunate to find some support from Sound Technologies and Neurologica, which is a subsidiary of Samsung Electronics. And working with these companies, we were able to bring in a BodyTom unit, which is the world's first battery-powered portable CT scanner, and felt that this would be an option for us to be able to get good images inside of Layla's skull. Even with the portable CT scanner, we still needed to get Layla moved from her normal habitat to the visitor space at the Pachyderm building, where we were planning to set up this portable CT unit. And we knew that this would be a big feat to move a 2,300-pound animal even that short distance. Working with our grounds crew here at the zoo, as well as our carpenter staff and a number of other support departments, we were able to successfully devise a plan to move Layla safely, and it was something that we put a tremendous amount of preparation into, and our wonderful teams here practiced through this procedure several times with 2,300 pounds of cement bags to make sure that we had all of our protocols in place and that we could achieve this feat safely. On April 19th, our team came together and performed what we believe to be the first CT scan ever done on a live adult rhinoceros. We were able to move Layla very safely into position, had the CT scanner slide over her head, and were able to achieve a fantastic set of diagnostic images to really outline what was going on within Layla's sinuses and nasal passageways. One of the major things that we were able to see on this CT scan was a problem associated with the last unerupted molar in Layla's mouth on the left side. At only 7 years of age, Layla's just recently been getting in the last of her adult teeth, and this one tooth was clearly impacted and unerupted, and the infection associated with that tooth was extending into the infection within her sinuses. With this information, it became very clear to us that we were going to need to undertake another surgery with Layla in order to access both this tooth as well as the infected tissues within her sinuses. And this is something that our team will move forward with within the next week or two in order to hopefully clear up and fully resolve this problem for Layla once and for all. Following this surgery, our team will likely repeat one more CT scan of Layla's head in order to get one final look at her sinuses and nasal passages to make sure that we have all of the abnormal tissue removed and that we can get Layla back to perfect health. At this point, I'm happy to report that Layla is doing well, and we will be working on the next steps in her treatment plan here shortly. The next time you're out here at Brookfield Zoo, please be sure to stop by our pachyderm house and see King and Nikili, our other eastern black rhinoceros. We look forward to seeing you soon.